There are certain conditions that will not allow a woman to use an IUD as a contraceptive method. In these conditions, the healthcare provider will have to evaluate the woman, see her risk, and then choose another method or help her to choose another method which would be more appropriate for her. Some of these conditions are 48 hours after delivery, that's 2 days after delivery, up to 4 weeks after delivery. Within this time, the chances that the IUD may expel is greater. So we wait either immediately after delivering, we give the IUD, or after 6 weeks of delivery, the IUD can be inserted. Within 48 hours up to about 4 to 5 weeks after delivery, it's not advisable to take the IUD because the risk of expulsion is high. Then another condition is a woman who has current ovarian cancer, a woman who is at a very high risk of sexually transmitted infections at the time of insertion. Is not advisable to give this woman an IUD. And then a woman who has severe or advanced HIV clinical disease, it's not advisable for the woman to take up an IUD. And then also we have something we call SLE. These people, it's not advisable for them to take IUDs. The next one I'll talk about is the hormonal intrauterine device. The principle of insertion is the same as the intrauterine copper device, but it works differently. What it does is, this time is not going to make the sperm weaker, but it will thicken the cervical mucus, so it prevents the sperm from moving up to meet the egg. It can also thin the lining of the uterus, called the endometrium, so that pregnancy or implantation cannot occur. The commonest side effects are the same for all other hormonal contraceptives. Acne, you may have some breast tenderness, you may have nausea, weight gain, dizziness, mood changes, sometimes ovarian cysts, sometimes you can get some distortions in your bleeding pattern, maybe irregular bleeding, abnormal bleeding, prolonged bleeding, light bleeding, and sometimes your bleeding may stop. Some of the health benefits of the intrauterine hormonal device: first and foremost, it doesn't make you get pregnant. Secondly, it prevents you from getting iron deficiency anemia because your menses may stop, so you would not lose any more blood. And then it may protect against certain cancers of the uterus, such as endometrial cancer and cervical cancer. It's been found out that it reduces menstrual cramps, it reduces heavy menstrual bleeding, and then it reduces the symptoms of endometriosis. It also reduces the risk of ectopic pregnancy. Very, very rarely would the intrauterine hormonal device perforate your uterus. Even though it can happen, it's very rare. And even rarer still, causing miscarriages or preterm birth. There are some misunderstandings on the use of intrauterine devices, which I would like to dispel. On the contrary, intrauterine device or intrauterine hormonal device can be used by any woman of any age. It can be used by women who have had children and those who have not had children. It doesn't cause any form of cancer. It does not cause any birth defects. It does not move to your heart or to your brain. Some people think that it will move to the brain, to the lungs, or to the heart, but it does not do that. A health risk is that if during the time of insertion, the woman had sexually transmitted infections such as gonorrhea or syphilis, then it increases her chances of getting a pelvic inflammatory disease.